an eye on them. The meeting is now being recorded, so everybody on your best behavior. Welcome to PRCAWA West Alabama. Thank you all for joining us today via Zoom. We're sad that we couldn't be together in person, but we will look forward to each of our monthly meetings, no matter what format they're in. And one day we will convene in person again. So to start the meeting off, I just want to remind everybody that we are doing a kind of a fundraiser support for a local school. We're doing Help Us Cover Seats and Feet for the Alberta School of Performing Arts. We're asking for donations of new socks and underwear for kids pre-K through second grade. They can be delivered to Miss Nancy Randall at DCH Trustee Hall. You can email her, reach out to her if you want to arrange any other type of delivery system. I believe there are probably going to be some options, but the dates are between now and September 10th. So please try to get out there and get something to give these kids to help them have a good school year with some new, fresh clothing. I believe that's all I have for the moment, so I will pass it over to Susan to introduce our speaker. Thank you all for joining us.
Hey, it's good to see everybody today. And I'm really excited today. I'm very glad to have Carrie Straylaw with us today. She's the Senior Social Media Specialist at St. Jude Children's Hospital in Memphis. And she was actually the first social media professional there at St. Jude. She has more than 20 years of experience in communications, public relations, media relations, social media. And we are very excited to have her here. She's going to be talking to us today about aligning your social media messaging with your market. So Carrie, thank you so much for coming. And we're looking forward to having you and looking forward to some good questions and some good discussion. I hope you're okay with us picking your brain a little bit after this. So.
Absolutely. Good
Thank you.
Afternoon, everyone. Are you guys Central or Eastern?
Central.
Central. Okay. Yes. 12. So it's noon. Okay. So I am Carrie Straylaw. I will give you a little bit of background. I have been, so thank you, Susan, for the introduction. I started in PR when I was 12. And so I like to think, but this gray hair and everything that I just got fixed like right before this is PR can be a lot. And so I've been doing this for a long time in public relations, was in PRSSA, PRSA. I'm a member of the Health Academy Board this year for the national. And, but what does that really mean? What experience do I have? I was in media relations at St. Jude for 13 years before transitioning into the first social media person. And I'll explain a little bit about how you can find social media for St. Jude. And then, like Susan said, I'm going to do a really sort of general overview, and then we can, dive into questions after that. So I will share my screen. Hopefully this will work again. Okay, thumbs up if you can see. Fantastic, thank you, Megan. Okay. So I changed this a little bit, but St. Jude Children's Research Hospital, our mission is finding cures and saving children. So we focus on pediatric catastrophic diseases. So you might have heard of St. Jude. It is a childhood pediatric cancer hospital, but we also focus on other diseases of children. So infectious diseases, hematological diseases like HIV and AIDS, sickle cell disease. But what people typically know us for is pediatric cancer. So it was founded in '62 by entertainer Danny Thomas. And I like to ask people, although I can only see like 4 of you at this point, but how many people know who Danny Thomas is? Okay. So I see one hand and one, I don't know who that. Fantastic. Some thumbs up. So Danny Thomas was an entertainer. The story in the 40s and 50s is kind of when he got his start. And so what he was struggling, his wife was pregnant, with Marlo Thomas. Who knows Marlo Thomas? Anyone watch Friends? She was Jennifer Aniston's mom on Friends. And you probably see her around Thanksgiving and Christmas. She is the one that does the commercials, Finding Cures, Saving Children, Thanksgiving. It's like a lime green logo. And I'll explain to you why that has literally nothing to do with what I do. But that is technically the family that started St. Jude. And Danny Thomas, the story is that he prayed to the patron saint of hopeless causes, which is St. Jude, to help him find his way in life, and he will build a shrine. And so he got a job right after that. Marlo was born, and he wanted to give back. And so he really did open St. Jude with a dream and got people involved to raise money. The fundraising organization called ALSAC opened in '57 so that they had the funds to then build the hospital. So as you can see in one of the first picture, that's what St. Jude looked like in the 60s, 70s, and 80s. And then the one below is more recent. It's not even as recent because currently there are more buildings going up as we speak. I've worked at St. Jude almost 19 years and I've never had a year with no construction, major construction all the time. We're only located in Memphis, Tennessee. So if you see a St. Jude sign somewhere else, that is probably a fundraising office, not the hospital. It's a very small hospital, only 78, about 78, 80 beds, because the goal for these kids is for them to be outpatient. And the big part of what Danny wanted was not only that it was a place to take care of kids, but he wanted research. He wanted to make sure that these diseases that were happening in childhood were being researched so that later on in life, people didn't have to deal with cancer. The goal, of course, is that we've cured cancer. And, some of our more recent CEOs said, my dream is to close St. Jude so that we don't need it anymore. No one pays. So all of your great donations help pay for all of it. So when a family is accepted into a clinical trial at St. Jude, you can't just come. They don't have to pay anything, which is incredible. And I wish there was many adult versions of this hospital. And then in 2017, we opened a graduate school. So that is currently in the accreditation process. So I bring all of that up to say that ALSAC opened up, the fundraising people are a completely separate organization, and they opened up social media in 2006. They had a direct ROI, basically. So they saw that if they got onto social media, they could help raise money, and it would be worth them going out there. I was on the media relations team at the time, and we had quite a bit of a process and a hard time getting a hospital on social. As you can imagine, I'm not sure where most of you work, but if you work in some sort of healthcare field, you know what HIPAA is, patient privacy. You work in a research institution, there's all kinds of regulations. You have to deal with OSHA. So it was very scary for our leadership to understand what social media was, think about it back in 2006, and what that would mean and how we would handle it. So outside got out there, they took the at St. Jude. They continue to do that, and they basically focus on patient stories, fundraising events. If you like celebrities and those who are getting involved, like Jennifer Aniston, that comes out of that area, donations, donors, campaigns. So I don't do any of that. It took 12 years to convince leadership that we needed to be on social media. I think, one of the lessons here is they wanted to see what other research institutions and hospitals were doing first. That's understandable. But we have continued to be like the person at the end of the train going, but wait, no, I know you already left, but wait, I need to jump on the train. It took 12 years, but we are providing this other side of St. Jude. So St. Jude is known as a charity, but it's also a children's hospital, an academic research institution, and a grad school. So to me, what this provides is this really great breadth of information and this good picture of what St. Jude is by providing this handle. So again, we're separate organizations. They have their own social team. I am the social person for the hospital and still, which I'll explain later how that works. And our focus is really about the employees. What are they doing? Is clinical care, research, if we're a great place to work, anything that our employees are doing with the goal of retention, recruitment, and education. So I keep this in my presentation to say we, until very recently, had one digital team for the whole institution, and we focused on the website, social media, physician communications, marketing, and advertising. As of May, and this slowly happened, I'm the only person, technically we don't have a digital team anymore. I got rolled into, after the reorg, into the media relations team, which is fine. And it's just me and the lady with the blonde hair and behind her, but all of us do completely different things. So we really gelled and worked together, but now we're all still in the same department, but doing completely different things. So you never know what a reorg could do, but we all still keep in touch. So coworkers, love your coworkers because they're your friends. So we have quite a few handles. In 2011, we opened up Twitter. And when I say 20 people had to approve the tweet, I'm not kidding. 20 people approved the tweet. We've come a long way. That's not how it is anymore, thankfully. We were just on Twitter with about 1,000 followers, and now we are on all of these platforms, and we're well over 214,000. My goal is not to have 1 million followers. I want those, and if we have 1 million, that's fine, but I want followers, and this is something to think about for you guys, who is following your channels. You want them to want your content. You want to educate people. You want to show them, oh, I never knew this about, I'm not quite sure what's in Alabama. I apologize, but things that it is that you guys do, you want them to know about that. But also, when we first started out, everyone knew ALSAC. Everyone knew the @St. Jude handle. They weren't really sharing hospital content and hospital related, things about employees. And so when we started, we were and we still are, sort of compete with them when it comes to attention. And I finally had to let that go and say, we're giving the audience a completely different look at St. Jude. We want people to follow both handles. We want people to learn about what ALSAC is doing from a fundraising perspective and how that money is working. But also we want people to know about the research and the clinical care, our facility dog program, so that we give them this really great opportunity to learn about all the aspects of St. Jude. So those followers I have, I want them to want to pay attention and read what we're sharing. If we post a photo of a doctor in the early days of this, no one read what I wrote. They just saw the picture and was like, oh, God bless you. You're amazing. He's my favorite doctor. I love him. And that's fine, but that is not me getting to the audience. So it has taken this amount of time, so almost 6 years, to provide information that I want to make sure our audience knows, but then to get an audience that is truly engaged in what it is we're giving them. They're learning, they're applying for jobs, and they really are engaged and interactive on that information. So part of that is storytelling is invaluable. So all of these go with storytelling. You want to be authentic. You want to, and I will say this, these photos are pre-pandemic. I'm the one that harps on people when they share stuff or give me stuff to share. And I'm like, where's the mask? We have to put a note on the photo. This presentation is pre-pandemic. So we work with our employees very closely on being a partner in this storytelling journey. We want to give people behind the scenes access. So you don't want to come to St. Jude unless you're an employee, right? So when we bring people into St. Jude, we do it virtually. We do it with stories. We do it with video. We do it with imagery. And because we don't want people to come here, and if you have a kid, of course, this is where you want to be, but this, that you're not going to come and do a tour. So this is how we provide that. And especially during the pandemic, we have cut all visitors off site. Visitors can't come in. Employees are routed in different directions than they were before. If you're in research, you go one side. If you're a patient care, you go on another, so that we can really minimize the spread of COVID. So now storytelling in this way is very, very important. And then, of course, those very unscripted moments when we rely on staff, and I'll get to that in a second. I'm just going to go through a few examples of some of the opportunities, again, 2019, where we really worked closely with some of the staff to, again, you're not going to get a tour or go into the nursing simulation lab, but it was very important for the nurses to be able to tell people these are things that they were doing as an education, so that if someone really wanted to come work at St. Jude to be a nurse, if a patient family was following, these are things where they say we're really do these educational opportunities, so that if you are a patient, clearly we've gone through what needs to happen in order to be qualified to do this. So we did, and this is like, I still use this because Snapchat makes me laugh about how different Snapchat is now than it was in the past. But we did some Snapchat and Instagram stories, again, really bringing people into the lab and showing them what a nursing simulation class looks like. One of the really cool things about St. Jude, and I'm going to say this a lot, so I apologize, pre-pandemic, was that our staff really did work closely and see every day the patients. So we have one campus, most of the buildings are connected, and we have one cafeteria. So when you go to get something to eat, you are going to see the patients, you're going to see the families, you're going to see the researchers if you're a doctor, vice versa. And Danny and the very first CEO thought that was very important, that we continue, and all these years later, we're almost at 60 years, to have one cafeteria. And our staff say how important that is. So they can go get food, go back up to their lab and go, I just saw this kid and I am inspired to go and do this work at the bench because this literally is helping someone who I just saw. And so one of the things that we like to capture is that kind of interaction. So that goes back to telling this authentic story from a way that that affects recruitment. So instead of saying like, apply now and you get to, hang out with patients, like we kind of do these moments. So in this case, this is research staff and they host a science fair for patients specifically. And that is fantastic for kids because then they learn about the science that is happening to then help cure them. And so it's this fantastic circle. And so we capture that on social media. Again, same kind of thing with Survivors Day. So we invite survivors back to campus who were treated at St. Jude. We consider them survivors from day one. So as soon as you're diagnosed, you're a survivor. And so this is, again, one of those fantastic interactions where you as a person would not necessarily be able to experience, but we want you to know what that feels like. And we want, not from a donation perspective, but from an employee perspective, from a retention perspective as well. And of course, patient care. Employees, and I go back to how we set this up. So St. Jude versus the at St. Jude research. One of the things that was kind of hard to do was we had before, and some of your organizations might still be like this, where social media was banned on campus. You couldn't get to it at all. Facebook was blocked. The only groups that were allowed to look were communication. So my department and then HR. And that was really just for monitoring rogue people, right? So when I was moved from the media team to social media team, I had really had to go and do this roadshow of sorts with our employees to say, okay, so I'm not doing media relations anymore, I'm doing social. I remember how we told you you should be completely scared about doing stuff and don't do this. Okay, now we're going to backtrack and I really want you to do that. And so I had to really make sure that our employees were a partner in this journey of social and continue that. So the biggest thing for us is this grassroots sort of conversation that started occurring. Oh, we can do social. Here's how to do that. And one of those big campaigns was when we opened a grad school. And so we had to work very closely with the dean, who did not know anything about social media. After we sort of had our very first conversation, he kept seeing me in the hall and kept saying, like, when can I Periscope? I want a Periscope. Of course, now we know Periscope has disappeared. So I haven't told him that yet. We're gonna have to figure out another way to do video this recruitment season. But you know, once we sat down and had that conversation, the grad school really became one of those really good advocates for social. And we took people into the school, which is connected to the hospital, really just as a hallway, but because they spend most of their time in the lab in the clinic. You know, doing this tour because we had never done this before. We did not have a school. It was very untraditional. The school is not accredited. So we really had to have people tell the story of why they should come, because at the time we didn't have any students. Now, of course, we have 5 years of students, which is amazing. And we can have the students tell the story. But in the beginning, I really had to sit down with the dean and get him on board. And so this was the first class. And I was there, you know, right there to meet the students their first day. We did the convocation together. I will say that our CEO was one of those people who was also hesitant about social media, didn't understand it. And that is him in the middle. And it sort of started his journey of being very excited about taking selfies and and jumping into photos, photo bombing, and you know, he started learning these terms, which is awesome. Now he's more into like the data and the audiences, which is great. But this is how it all started, really understanding like, oh, this is, I'm going to take the picture, it goes up. Yes, that's how this happens. We sort of, you know, I sort of talked about behind the scenes, it kind of goes hand in hand, but our structural biology department had a reorganization. And so they had a new chair, they had new employees, and we introduced those employees using social. And then a few years after that, in the field of structural biology, if you can get this magnet, it's a huge, huge, huge win. And so we went behind the scenes, took people into the whole process of the magnet being craned. They had to wiggle it down into this like very, as you can see, very deep hole, bringing it in. And so we did this live, and these are huge numbers for us. The impressions for Facebook, we ended up doing some paid, and of course, you know, Periscope, which is connected to Twitter. It was astounding how many people watched. I think we were at like 3,800 viewers at some point. And I mean, it's a 28-minute video. It was live and people jumped on and off, but it was really one of those things where, you know, we have a fenced in, closed down campus. And we wanted to make this new spectrometer exciting for people. And again, really not only keeping the structural biology department happy because they were excited and it's like, this is huge. And it's like, it is, but in your area. Not everybody's gonna be excited about a really big magnet. So how can we make that exciting? We did Facebook Live. We, you know, did this very fast, the magnet coming off the truck, and we fast forwarded it. So that was exciting. So all of this continues to go back to really mining that relationship with employees and getting them to feel a part of the process, but also making maybe something that normally people might not be super excited about, making that feel exciting and feel personal. And we do that in several ways, even with media relations. Again, you know, So behind the scenes, this is Dr. Webby. You guys might have heard of him at this point. He works closely with NIAID, which I think more people know what that is, Dr. Fauci's group. So he is a virologist, and he's now, he's been in a lot of the media lately. So we do these behind the scenes, watch CNN. He just got interviewed, kind of giving a preview. When conferences were in person, we would go to conferences and, again, give a little preview. Not everybody's going to go to a cancer research conference, but again, that's something that's very important to our mission and important for our audience to know about. And then this last photo was kind of funny. We tried something out, and social is all about, trial and error. Well, not error, you don't want to have an error, but you want to try things within the realm of not being very risky. But one of the things we tried was to be on Facebook Live, Periscope, and Instagram Live at the same time. And so the person who took the photo was our analyst, and then that's me on the left and my boss on the right. And so we streamed at the same time so that we can get all of these audiences to see kind of who was paying attention, which one would work, instead of doing one and then sharing it. And so we were able to get some data from that to see, what time of day was best, what platform worked. And of course, the numbers and information from years ago, 2019, went out the window with 2020. If someone says, what's the best time to post on social media? I don't know, it depends on what's trending, especially right now. And then finally, these unscripted moments. So it's really important. We have an on-site photo, video, graphic arts department, which is awesome. But this is an example of our admin got a call that the Blue Angels were going to fly over, which of course are out of Pensacola, Florida. They were coming into Memphis. They were going to fly over St. Jude, and their PR person called our department and said, want to let you know this is happening. It's going to be in 10 minutes. Well, we called our photo department and they couldn't come out. We put like an all call to all employees. Hey, if you want to see the Blue Angels, you literally have to run down the stairs and come now. So I ran out there with a few other people on our team, and this is the only photo and video we got because no one else got out there. We had people calling us an hour later. When are they coming? Oh, like an hour ago. Can they come back? No, that's not how this works. So you never know. And I don't mean this to sound anything against our photo department, but they're great. But the topping off of the tree. So when you build a new building, a lot of times people put a tree on the top to sort of signify the end of the build. That's the top of the building. So we heard from construction that they were going to do this, and there was going to be a ceremony to do it. Well, so photo was supposed to be there. Photo got delayed, and they didn't come. And the chopping off of the tree happened. And guess who had the image? Me, because I was there grabbing the image because photo wasn't there. They're normally great. And I'm sure that if they were on, they'd say, hey, we do a good job. You do. But I use these as an example of sometimes in the moment, grab your phone, grab your camera, and get that, because it's not going to go. It's not going to come back. And people love that kind of stuff. Our PhD and our postdoc recruitment office do poster sessions. Now, of course, they're virtual. But in that sort of educational piece where we were trying to get employees to really understand that it's okay to do social now and how to think about that, I happened to be in this lobby and saw the poster session and found the recruiter and said, hey, I would love to do this on, at the time, Snapchat and Instagram stories, and really give people an idea of what it's like to present. And so we went around and we did these. They're not our students, they come for this kind of program. And so we walked around and interviewed some of the students. We got them to say their university, so we're able to tag that when we posted the video. So again, we get that engagement from an outside organization. And then when we were a few years ago, #1 on US News and World Report for top children's cancer hospital, again, doing those sort of unscripted moments where we grabbed people and said, what does this mean to you as a nurse, as a doctor? And we were gave a preview on social before we posted the full video. This all goes back to your employees are your best ambassadors. So however that looks to your organization. So in the beginning, we did these travel. It's just so funny now looking back of how much we relied on in the moment and travel. So we did some luggage tags, and we were, because our staff travel, and they still do, around the world. And so we provided these for people. And then this is our CEO, who really made this great, turn and exciting, talking to faculty and staff at one of our really big meetings, like a town hall, and said, hey, you guys are going to get this in the mail, definitely use it. Here's why social is great, which I never thought I would see that day, which is awesome. So when people traveled, they did take pictures, and of course we put a hashtag there, which is the hashtag we use for our staff when we ask them to post stuff. So I think it was like Toronto and Detroit, and we got some from South America as well. And then really quickly, this is an example of someone who, so this is Dr. Justin Baker. You might not be able to tell from his very excited smile, but he is a palliative care doctor. So that is end of life care. He approaches it in an amazing way. It's a celebration of life. And so he has become this really amazing thought leader in the world of pediatric palliative care. And so he was on Twitter. And when I went around and kind of did these road shows, he was one of the first people I went to and said, this is where we're going as an institution, and I would love for you to be a part of that. And so when we did the palliative care symposium with him back in 2017, is the first time this happened, he really took advantage of social media. And now we have specific hashtags for the conference. You can see that's our CEO doing his photo bomb in the middle. And so what that led to the next year was our department gave him Communicator of the Year, internal, for all the work that he was doing. And he really did become an inspiration for some of our other employees. And so in between, during the conference, we did these Instagram stories and Snapchat to really say, hey, and this is where we are. And if you couldn't come, we wish you were here, which is kind of interesting since things are virtual now, and those are things you say anyway. And so this is, again, something that's super important when you're telling stories is, you as an institution can tell the story, but when you can have your employee really put that personal spin on it, that is massively important. And speaking of that, two of our clinicians/researchers were very involved with social media. And while I was doing some, of those roadshows and 101s and teaching people about how to use social, I really involved them on all of that too. So they had done some Twitter takeovers professionally. And then them, along with Anoya, who is in our postdoc recruitment office, got them to kind of talk to their peers at St. Jude. And so they hosted an educational session for faculty. And at the time there was probably, the room was filled. I was very surprised because it was social. And after that meeting, we had about 20 people join Twitter, people who I would have never, ever thought. And they are still very, very active. This is about, 2019 is when I did this. So hearing from their peers and them addressing, I don't have enough time, I'm not creative, I can say that all day long, but to hear that from someone who does what they do was very, very important. And then finally, this is just a really good example of how all this comes together. So we had posted this scientific image on Instagram, which I had seen in the hospital and taken a picture of, and the researcher, it's actually fruit fly wings, believe it or not. Because we use fruit flies in some things. Well, posted it on Instagram. The National Cancer Institute, which is a very important organization to be a part of, they saw the tweet. They contacted the researcher and said, can we use that image in this booth at the American Academy of Cancer Research? meeting coming up. We're going to do this close-up project. Well, the Washington Post happened to be there, did a story about that project. And so the image that was initially hanging on the wall ended up in the Washington Post. You just never know where it's going to go. And that year, this cancer assassin, that's just his handle, but he chose us as the #1 Instagram page for that year, which was amazing. And so these are some of the things that we did on Instagram. It was like, oh, we're going to take advantage of the fact that you call us #1 and kind of do some things that are a little more outside of the box. One of those is talking openly about LGBTQ and our employees, which for being a hospital in the Mid-South actually did extremely well. And again, going back to that recruitment and retention made a very, very big impact on our employees. We had not done that before and gotten permission and approval from leadership to do that. So that was a very big moment for us. So very, very quickly. So you got all this information. Hopefully it's helpful. So what do? Go and find your influencers, your employees. Make the most of your content. Just because it sits on one channel doesn't mean you can't use it somewhere else. As a team of one, I've got to do that. Some things to think about when you're posting. Always include a call to action if you can. You want somebody to be able to do something from reading your content. For ALSAC, they want them to donate. For us, we want them to learn something. So we try to send them to specific pages on our website to learn more. Of course, mining your internal network, that is huge. That is a photo. We made those letters and then we got a bunch of employees to take pictures with all the letters, and we're able to use those not only across social, but internally as well. Think on your feet. You don't have to be super creative. This is a colleague's shirt. So we were at an Employee of the Year event and I was posting as it was happening and I needed a background. And so I turned to him and was like, your shirt, that looks great. Turn around. And I took a picture and I added text and there we go. So it doesn't have to be something that is pre-produced. Social is about, in the moment and being creative, but you don't have to have something that's fully produced and branded. In fact, most recently, we've gotten dinged a few times on Instagram for being too branded on some things. So we really have to think about how to pull back some of that. And that, sort of personally too, you don't have to be on all the platforms. Definitely collaborate. PRSA is a fantastic way to do that. Look within your industry, of course, blogging and influencers and, following hashtags, which you can do now on all of those platforms. If you're managing social, who is your audience following, your followers? Kind of dig into that and give yourself time to do that. I usually tell employees when they say I don't have time to do it, spend 10 minutes a day. You're drinking coffee in the morning, go to LinkedIn, go to Twitter, go to Facebook. I do this myself. I'm on social media almost 24/7 because it's my job. But personally, when do I do it? I am in the morning drinking coffee and I have my little pattern, Facebook, Instagram, LinkedIn, Twitter. And then that's it. And then at the end of the night, I will look again. So give yourself that window. And I say 10 minutes because if you're not paying attention, you're going to go down a rabbit hole. And I know we have all done it, especially on YouTube. So give yourself a time limit of what that is. And you don't have to post every day, and you don't have to, and again, this is personal and also organizationally, you don't have to post every day, but definitely interact with things. Like things, if you're on Twitter, retweet it. What I've been doing on Instagram is if I don't have a nice photo, I will look at stories and I will, right now vaccination is huge. And so I'm finding these funny memes and all of that, and I'm posting on stories. So then I'm constantly sort of putting things up, but give yourself a time limit. And that seems to be working really well for our very busy faculty, doctors and researchers. Organizationally, Hootsuite, and I don't get paid for any of this, but Hootsuite, Canva is massive. Canva. Most of the stuff I put out, I've done in Canva. I mean, of course, Box to share from computer to phone, from person to person. the trends are interesting right now. Of course, I don't know if you know this, but the Pew Research did a study where they were able to put a percentage into how many people have been using social over the pandemic, and it went up astronomically because this is how people were connected. I'm interested to see their next study to see if going back, but then coming back, or, people are more hybrid, what does that look like? But right now, social is still extremely important and people are paying attention. You think about where you get your news. I mean, I get my news on Twitter and then I might go turn on CNN or whatever it is, but that's really where it's coming through. The day that Prince died, I found out from TMZ, someone shared, I don't follow TMZ, but someone shared TMZ within 30 seconds of the announcement that he died. And I'll never forget that because it was Prince, but also that is how fast news comes out. And then within the hour, it was across the world. Chatbots and automated responses are things that people are looking into, especially because of the heightened use of social. We are doing much more paid now. So paid and organic really go hand in hand. If you want to get really tight analytics, targeting, of course, paid. I'm always hyping LinkedIn. Even if you're just scrolling through and liking some things, it's very important to make sure that the app and your followers don't think you have abandoned them. And we talked very much about influencing and making things personal. And these are our facility dogs, Huckleberry and Puggle. I manage their social media on Instagram. So if you want to follow them, they're St. Jude Paws, PAWS. And I was a little hesitant about doing a dog Instagram, even though we all know dogs are fantastically popular on Instagram, because I wanted it to be strategic to connect with the institution. What are we going to talk about? We had a pretty good plan in place before the pandemic, and now it's dog content. I try to make it relevant, but not always, because they're not always on campus either. And so every few days I do get text from the dogs and they tell me about what they're doing, and then I post it. And that's the handle, St. Jude Research, to follow St. Jude if you'd like. I'm going to stop sharing my screen.
Carrie, thank you so much. I mean, I was furiously taking notes here. I'm glad this was being recorded. Who has questions for Carrie? Megan, I see your hand.
Yeah, and you might have answered it right there at the end for me, though, because during the presentation, I didn't notice you mentioning LinkedIn at any point. And so I kind of wanted to just ask the idea with the different social medias, this is something that comes up a lot, the idea of posting differently on different ones. So I imagine like your research side probably posts more to LinkedIn in order to connect with research professionals and stuff. But I mean, do you really use it equally? I know it's not your responsibility, but the fundraising side, do they use LinkedIn equally, or do you see like differences in the ones that each uses more heavily?
Yeah, so it took a year to get LinkedIn to allow us to have two separate, I guess, presence on LinkedIn, because even though it's ALSAC and it's a separate company, they still have the same end of their email. So it still is at stjude.org. And to LinkedIn, and it's just kind of interesting. To them, we're all one organization. And so we had to prove that we weren't, even though our email was the same. It was crazy. So how it's built is that because ALSAC existed before, they're the parent and we're the child page. So our jobs, even though like you can't be a doctor and work at ALSAC because they're the fundraising people, our jobs get mushed together. So it's something like if you follow ALSAC and a job posting comes up, it could be a doctor, but it's actually from our site. So it's kind of this mishmash. So when we post organic content, if it has to do with our employees, they're supposed to share it with me for me to review for, red flags, and if the employee left or, something's going on and they're about to leave or get fired for not being vaccinated, which is interesting, and that's happening in the next few weeks for us. And when they post, what they're supposed to do, and I keep trying to tell them this, is it needs to be about working at PRCAWA, not anything about us. Because when someone wants, the whole point of LinkedIn is professionalism and finding a job. So I think that they're understanding that, but I think part of that is the pressure from their leadership to say, we need to be more on LinkedIn. I think, well, then you need to talk about what it is to work at your company, because you don't work at St. Jude. But they have done, I think, a good job of trying to weave the fundraising message into their organic posts without it being about our employees. I don't even know if that helps answer your question, but LinkedIn is extremely valuable. I've tried to, since it's just me, and with this reorg, we brought in a social person that was in another department. So I'm trying to pull her in so we can kind of do things together. So technically I'm not alone anymore. But she's only been at St. Jude for less than, about a year or so. But I try to put one version on Twitter and a different version on Facebook and LinkedIn. To not only is there not enough room on Twitter for some of these things, but to call out the employees who were involved. So it does make it more specifically on LinkedIn, more relevant to recruitment and retention. So let's say, someone very recently just posted a paper about some sort of algorithm in immunology. So on Twitter, it was just a little bit about the paper, but then on LinkedIn, I called out the researchers and said they were part of a team to da-da-da, especially because the picture was of both of them. And so I called them out. I'm trying to do more of that. And I hope that with having an additional person and hopefully more in the future, we really can segment the message even more to the audience on that platform. I haven't done it a ton because I just, at the end of the day, I'm like, go, go, go. What's next? Go, go, go. Yeah.
What other questions? Well, I'll ask one, what was your biggest learning through this? I know that you really created the social media presence for St. Jude. So what was the biggest thing that you took away that, maybe you wish you'd known when you first started the process?
That it would take 12 years to get it done. I think that relationship building is huge. When you're in public relations, no matter what part of PR you're in, right? And just because I was coming into the room as a PR professional and knew a little bit about social media, didn't mean that the employees are going to listen to me. I mean, I hope they did, because we had built a little bit of, trust over 13 years, but social was just so different for them, for many of them. The doctors and the researchers who've been here for a long time, like, wait, you told us not to do this, and now we are going to do this, and now I'm nervous about how to do that. And I wish I had in the beginning more of a foundation. So I was talking about the train, like the train had already left. Alsac had taken the social train. So not only do we have to jump on, but I had to post at the same time. And so I didn't stop and do a foundational, I'd say document, but like those types of things first, the guardrails, the guidelines, the 101, I eventually did, but in the beginning, really kind of setting that process in place, knowing like, okay, these people, they're not going to be like, yay, social media. So what is going to make them feel comfortable using that? Seeing Harvard do it, seeing Mayo do it, and using who they look to when it comes to research, and showing those as examples that they do social media too, and here's how they use it. And that's what I do now. But in the beginning, we were just running to catch the train instead of, well, no one knows we're even out here. So let's do a little bit of posting and a little bit of meeting with people while we spend more time building those foundational pieces so that when we do pull it all together, it already exists. And now with this most recent reorganization, our new VP asked me that exact thing. Do you have your documentation of all of this? And I was like, I do, but not presentable. So I had to go back and kind of do that so that she knew, she doesn't know anything about social. So she kind of had that, okay, here's a little bit of 101, why do we do it? Here's our mission and goals and audiences and how do we get there and the data collection, all of that. And process and relationship building.
Awesome. Any other questions? Well, Carrie, this has been really great. Thank you so much again for joining
You're
us. And
welcome.
taking the time out.
Hope you learned a little bit.
I definitely did. I really appreciate it. If I have any other questions though, I'll reach out to you later, but thank you so much for joining us. I appreciate it.
Thanks
So
for
Megan,
asking. You guys have a great day.
Thank you.
Yes.
You too. Megan, I will turn it
Bye.
back over to you.
Yeah, thank you again, Miss Carrie. Thank you all for joining us today. Please mark your calendar for next month. September 28th will be our next meeting. Again, remember that between now and September 10th, we are taking donations for the Alberta School of Performing Arts to help us cover seats and feet. I want to say feet, it's just feet though, seats and feet. So new underwear, new socks delivered to DCH Trustee Hall, Miss Nancy. Reach out to her via email if you need to set up any other type of drop off, but please participate in that. You got a couple of weeks to get things in and those kids really need that help. So thank you all for joining us. Have a great rest of the week and we'll see you all next month.